Hello, today I will be doing my MRI case study presentation for the fall semester of 2023. Today's presentation is as follows. I will have an introduction, the patient screening / workup, the imaging and protocol, patient management, follow-up, and a list of references. During my clinical rotation, I was involved with a patient with the initials RL. He was a 73-year-old male presenting with abdominal pain, and he also had a prior history of cancer. During this exam, I was able to wheel the patient from his room, and I assisted with getting him on the table, and I also performed the imaging sequences with assistance from one of the technologists. An MRI abdomen exam was performed, and it was with and without contrast. Upon completion of the exam, the radiologist diagnosed him with pancreatic tail mass that was highly concerning for pancreatic adenocarcinoma, extensive hepatic metastatic disease, and also he had numerous enlarged upper abdominal lymph nodes concerning for nodal metastases. In the following images on the bottom, on the right, we have an MRI image of a pancreas that is showing adenocarcinoma. The arrows are pointing to the different areas of the cancer within the pancreas. And on the left, this image is an axial MRI of the abdomen, and I think it's showing like the hepatic disease that's metastasized all throughout the abdomen. For the screening and workup, upon looking at his medical history, he had a medical history of cancer, glaucoma, diabetes, blindness, and he had mentioned having chemotherapy. He has a family history of diabetes and hypertension, and for his surgical history, he's had a biopsy and an IR VAS cath placement. And for other correlating diagnostic studies, he has had previous abdominal MRIs. And the patient also had his creatinine checked before the contrast was even administered, because we have to make sure the patients have adequate kidney function before giving them contrast. So the imaging and protocol, these are all the imaging sequences that were performed to get the images. The equipment utilized was the large body coil, the contrast power injector, headphones so that the patient can hear the breathing instructions, and also so he could hear us when we had to check on him. And we also utilized pillows and cushions for the patient's comfort. So due to the patient being blind, the tech and I had to be very intentional and clear with our instructions, because when you're dealing with a patient who cannot see, it's very important to communicate clearly so they don't end up hurt, so they understand what's going on. Luckily, the patient, he was very, very sweet. He had a very joyous attitude, and due to him having all of these a history of medical issues, being in and out of the hospital with cancer and chemotherapy, he kind of knew what to expect. So it was I would say it was easier to talk to him and make sure he understood what was going on. Also, during the exam, we did keep a close eye on him visually and verbally. We made sure to tell him what was coming next so he knew what to expect. And we also kept an eye on him, made sure he wasn't having any type of reactions to the contrast dye, because after contrast, patients can have post-contrast reactions, whether it be allergic reaction or anything else. However, he has had previous MRI, so getting contrast wasn't something that was new to him or something that previously brought him any issues. Upon the follow-up, the radiologist did not report any additional imaging requests. I guess what the images that they obtained was enough to diagnose him. As far as the treatment plan, once the liver cancer becomes metastatic, it can no longer be treated with surgery, and chemotherapy and target radiation therapy are also more treatment options. Overall, the prognosis for Pancreatic cancer is very poor. The 1 in 5 year mortality rates are 24 and 6%, and the 5 year survival rate for a patient whose liver has cancer that has metastasized is an estimated 12%. So this patient had extensive hepatic liver disease, and though his prognosis was poor, he was a very great patient. He had a very great attitude, and this case study stood out the most to me because I had never seen a case of cancer this bad, especially that widespread in a person's abdomen. And though his prognosis was poor and he may not make it that much longer, it was a great learning experience, and I really enjoyed this case. And here's a list of my references.